Imagine what life would be like here. It certainly looks idyllic. Families making their way to the river to fetch water for the home. The home, being the smallest social unit, can then do its part to support the economic fortunes of the community. So much of family life depends on trips to the source of water, cooking, washing, and sanitation. As it turns out, much of family life is threatened by these very activities in the South-South region of Nigeria. This is of course no fault of theirs. The same bodies of water that sustain livelihoods in this mostly riverine area are also responsible for the dangerous growth of the female Anopheles mosquitoes, which act as vectors of malaria.
Malaria is one of the commonest diseases in Nigeria, accounting for about 300,000 deaths of children under the age of 5.
It has caused sickness, poor health. It has caused poverty in so many families.
The number of people that die in malaria is quite high. Most people don't know that. We're not aware. We are aware of the big names of diseases like HIV and the rest, but we don't know that these smaller diseases like malaria, cause a lot of death.
At the end of the day, a child that was supposed to be in school because of his fever would not be able to attend the class that has been paid for. The mother that is supposed to be taking care of the family cannot keep to that, probably cannot even get to work.
Every condition, ill health in this locality is that malaria, and that is our problem.
When someone came in and complained of fever and cough, we would say that really is malaria, because those are signs and symptoms of malaria.
According to the protocol, in Nigerian protocol, every fever case should be tested using RODT or microscopy. And then those who are positive should be treated. But we found out that there were a lot of treatments. The number of people treated were more than the number of people that were tested positive.
Malaria symptoms can resemble the symptoms of other diseases, and this is the reason why regular and accurate testing is crucial. The RDT helps to detect specific antigens produced by malaria parasites in the blood of infected persons.
Before Africare came in, we were using RDT manually. So if the result comes as negative, if you tell the client that it's negative, you will not believe you. You say that you are playing with them.
In fact, you have a headache now, they just ask you what is wrong, is malaria. And therefore, all we know is treatment.
And at times, clients will say, hey, this is malaria, I can't go out of here because government has already, the NGOs has already bring the free malaria drugs, so they have to benefit from it.
It is this lack of information that has led to waste of medical resources and time, and may have even led to deaths due to incorrect diagnosis of the condition.
Most nurses and clinicians were treating presumptively. Presumptive treatment is treatment based on symptoms, signs and symptoms, rather than diagnosis.
If we have incorrect diagnosis of malaria, what ends up happening is that we cannot plan adequately for people that actually need the treatment. Is that we're going to be over-planning, underestimating, overestimating needs. Because if you're relying on your clinical judgment to determine whether a fever is malaria, the tendency is that you very likely will be treating more cases of fever as malaria as against what it actually should be. That makes it that government needs to, and its partner needs to, buy more anti-malaria commodities and more test kits than they actually need.
And so, the scourge of malaria continued to threaten active community life, with 30% of residents being admitted to hospitals, while 60% were receiving outpatient treatment. A silver lining emerged when the Decky reader manufactured by Canada's Fio Corporation was introduced. It was quite literally a lifesaver. Patients and stakeholders had begun to lose confidence in the results produced by the RDT method.
It's one of the innovations that I give kudos to, because it has really helped us, in particular in Eket local government, because it has reduced the time that we used to spend in running malaria tests. Mothers, fathers, youths, children just come in within 20 minutes, they have their test done and they have their results given to them.
The efficiency of Deki Reader in Ibom, even in the riverine, it has made people there to know that they don't need to go to the chemist when they have fever, and they will go and tell the chemist people I have malaria. They now rush into the hospital with the help of Deki Reader, and immediately they see the machine, they'll be happy.
So we get to know exactly what kind of fever you have, and we can direct the treatment that way. Because if we end up having to give you medications or drugs for monkeypox, for malaria, when you actually have monkeypox, you can imagine what could happen. And if we're treating you for malaria when you actually have Ebola, we'll be actually ignoring what we should be treating. And of course, the consequences will be grave.
There has been an improvement in the diagnosis. And in doing so, we have conserved resources which hitherto would have been abused, but now rechanneled into other areas of clinical treatment or control and prevention of malaria.
One of the challenges we have in malaria management in Nigeria is data, the reliability of data. Most of the data that we are quoting in Nigeria, probably some people have doubt about them. But when they are electronically operated and the device is sending the data direct to the cloud, the funders tend to have confidence in the data that is electronically captured rather than manually captured.
It makes our work flow. Because if you tell them that you don't have malaria, but this machine is telling you the truth, they will believe you. And with the use of this Deki Reader, it makes our work goes very well. And also it attracts a lot of people into the clinic.
People always want to see you working with an instrument or with an equipment. So when patients come in and see you inputting their data into the Deki Reader, they rest assured that you are actually doing something. So when you now do the test and give them the result, they now believe that it's the true picture of the test result. So they feel comfortable and they are satisfied with the result. They will not force you to maybe put positive in order for them to get their drugs.
You also address the issue of faulty RDT. Some RDT which normally give wrong results or error during the process, Deki Reader would automatically detect.
When there's any challenge in terms of malfunctioning, it's a device and it could go bad. You have a technician that is available, that few actually employed a technician, a standby technician that goes around with our monitoring and evaluation officer in the facilities to check the device on a monthly basis. Maps-C project started in 2011, in around September 2011. Some of the activities of the Maps-C project include sensitization of the vendors and their families, and also community members. The local government areas where we work in Rivers are Ogubolo and Boni local government area. And in Akwa Ibom is Ibom and Eket local government area. So we have carried out malaria outreaches in these localities.
The goal of the project aligns with the national objective of reducing the malaria burden to pre-elimination levels and bring malaria-related mortality to zero from 11% per annum. Another goal of the project is to meet the information requirements of the Nigeria National Strategic Plan, which is to provide adequate information to every Nigerian so that at least 80% of the populace habitually adheres to appropriate preventive and curative measures.
Africare was here at Nkpanak. They came with a program, World Malaria Control, like that. So when they came, they were health talk they conduct a health talk. Then after that, they were testing and they're giving drugs to people.
Mosquito nets are being given free in order to help people in the community to prevent malaria, and information on how malaria can be. Maybe somebody can get malaria, a mosquito can transmit malaria, is being disseminated to people.
Most of these commodities were provided by the state government, but people may not know that they are there. So it has created awareness that these commodities are there, and so it has helped to increase facility utilization. And also, because we conduct monitoring and supervision, the health facility staff are available in their facilities to attend to the patients when they come.
This facility was not functional. People did not know this place. People did not come here for treatment. But shortly when Africare came in, they started to create awareness.
This healthcare facility is back again. They are alive again because people are making use of it. Before now, it was a waste thing. We didn't make use of it because many people didn't get the information. But now people got the information, they come out, they're making use of it.
Before now, some people believe that one can get malaria through standing under the sun or walking too much or taking much of oranges. But with that presentation, people's minds were clarified that you can only get malaria through an infected female Anopheles mosquito.
We have also done a lot of training of health workers in various aspects of malaria control, including prevention, emphasizing the use of long-lasting insecticidal nets, and monitoring and supervision.
What they have done in training the staff for malaria, it has also extended to other cases. The knowledge they acquire has also helped them in other cases.
Many who don't have money, no, they suffer for it. They even die because of malaria, many. So I'm so excited for this thing to come to us. We have benefited because we have not gone to hospitals to spend our money. Those who doesn't have got free drugs.
Now that I have seen people, the Africare giving drugs in the first instance, they are giving free medical treatments, tests, free. I believe next time maybe they will do more than this.
We will want them to continue doing it like that because we were so much interested in it, and we would love them to do it again.
Let it go round all the local governments because this is just the right thing to be done. We must get it right.
The state has been very supportive, especially Akwa Ibom State has been very supportive. They attend our various workshops that we organize. Almost all the workshops, even the training workshops that we organize, we have the state represented, we have the local government represented.
We are making the environment favorable for our partners to come in. In that sense, we ensure that we provide adequate personnel.
Yeah, we want to say a big thank you to Exxonmobil, for the opportunity that they have given Africare and the trust they have in Africare to implement this project. There are different organizations implementing programs and projects in Nigeria, but Exxon has identified Africare as an organization that they can do business with, and we have not disappointed them.
The fight against this disease is not yet won, but the concern and commitment of Exxonmobil and Africare is providing relief and perhaps hope that until the dreaded scourge of malaria is eradicated, young children, pregnant women, and men will live to contribute their full potential to nation building and economic prosperity.